Hey, Alpha Nurses, I'm Licensure from AlphaNursGuide.com. This is 15 practice NCLEX questions. Without delay, let's get started.
A client is prescribed metoprolol via a meter-dose inhaler, 2 puffs every 4 hours. The nurse instructs the client to report adverse effects. Which of the following are potential adverse effects of metoprolol? 1. Irregular heartbeat. 2. Constipation. 3. Pedal edema. 4. Decreased pulse rate. The correct answer is 1. Irregular heartbeat should be reported promptly to the care provider. Metoprolol may cause irregular heartbeat, tachycardia, or inguinal pain because of its adrenergic effect on beta-adrenergic receptors in the heart. It is not recommended for use in clients with known cardiac disorders. Metoprolol does not cause constipation, pedal edema, or bradycardia. Which statement by the client indicates an understanding of the teaching regarding the use of magnesium sulfate and corticosteroids for preterm labor? 1. I will be on magnesium sulfate and corticosteroids until my baby's due date, so he has the best chance of doing well. 2. The magnesium sulfate is to stop contractions while the corticosteroids increase lung surfactant in my baby, so he can breathe better if he is born early. 3. The goal of the magnesium sulfate and the corticosteroids is to stop contractions and help me get to my due date. 4. If I take this magnesium sulfate and the corticosteroids, my baby won't have to spend any time in the neonatal intensive care unit if he is born. The correct answer is 2. Corticosteroids given IM have been shown to increase fetal lung surfactant and reduce the risk of respiratory distress syndrome in premature infants. It is not a guarantee that a premature newborn would not have problems at birth that would require time in the neonatal intensive care unit. The administration of the corticosteroids is normally completed within 24 to 48 hours. Magnesium sulfate is currently given IV to women in preterm labor to stop contractions and therefore prolong gestation long enough for the corticosteroids to be most effective for the fetus. Magnesium sulfate is not always effective at stopping preterm labor. The nurse is teaching the client how to use a meter-dose inhaler to administer a corticosteroid. Which of the following indicates that the client is using the MDI correctly? Select all that apply. 1. The inhaler is held upright. 2. The head is tilted down while inhaling the medicine. 3. The client waits 5 minutes between puffs. 4. The client rinses the mouth with water following administration. 5. The client lies supine for 15 minutes following administration. The correct answers are 1 and 4. The client should shake the inhaler and hold it upright when administering the drug. The head should be tilted back slightly. The client should wait about 1 to 2 minutes between puffs. The mouth should be rinsed following the use of a corticosteroid MDI to decrease the likelihood of developing an oral infection. The client does not need to lie supine. Instead, the client will likely to be able to breathe more freely if sitting upright. In which of the following maternal locations would the nurse place the ultrasound transducer of the external electronic fetal heart rate monitor if a fetus at 34 weeks gestation is in the left occipital-anterior position? 1. Near the symphysis pubis. 2. 2 inches above the umbilicus. 3. Below the umbilicus on the left side. 4. At the level of the umbilicus. The correct answer is 3. As the uterus contracts, the abdominal wall rises and, when external monitoring is used, presses against the transducer. This movement is transmitted into an electrical current, which is then recorded with the fetus in the LOA position. The cardiotransducer should be placed below the umbilicus on the side where the fetal back is located and uterine displacement during contractions is greatest. If the fetal back is near the symphysis pubis, the fetus is presenting as a transverse lie. If the fetus is in a breech position, the fetal back may be at or above the umbilicus. A client with acute asthma is prescribed short-term corticosteroid therapy. Which is the expected outcome for the use of steroids in clients with asthma? 1. Promote bronchodilation. 2. Act as an expectorant. 3. Have an anti-inflammatory effect. 4. Prevent development of respiratory infections. The correct answer is 3. Corticosteroids have an anti-inflammatory effect and act to decrease edema in the bronchial airways and decrease mucus secretion. Corticosteroids do not have a bronchodilator effect, act as expectorants, or prevent respiratory infections. The primary healthcare provider prescribes betamethasone for a 34-year-old multigravida client at 32 weeks gestation who is experiencing preterm labor. Previously, the client has experienced one infant death due to preterm birth at 28 weeks gestation. The nurse explains that this drug is given for which of the following reasons: 1. To enhance fetal lung maturity. 2. To counter the effects of tocolytic therapy. 3. To treat chorioamnionitis. 4. To decrease neonatal production of surfactant. The correct answer is 1. Betamethasone therapy is indicated when the fetal lungs are immature. The fetus must be between 28 and 34 weeks gestation, and birth must be delayed for 24 to 48 hours for the drug to achieve a therapeutic effect. Antibiotics would be used to treat chorioamnionitis. Betamethasone is not an antagonist for tocolytic therapy. It increases, not decreases, the production of neonatal surfactant. A client experiencing a severe asthma attack has the following arterial blood gas results: pH 7.33, PCO2, 48 PO2, 58 HCO3, 26. Which of the following prescriptions should the nurse perform first? 1. Albuterol nebulizer. 2. Chest X-ray. 3. Ipratropium inhaler. 4. Sputum culture. The correct answer is 1. The arterial blood gas reveals a respiratory acidosis with hypoxia. A quick-acting bronchodilator, albuterol, should be administered via nebulizer to improve gas exchange. Ipratropium is a maintenance treatment for bronchospasm that can be used with albuterol. A chest X-ray and sputum sample can be obtained once the client is stable. When preparing a multigravida client at 34 weeks gestation experiencing preterm labor for the shake test performed on amniotic fluid, the nurse would instruct the client that this test is done to evaluate the maturity of which of the following fetal systems: 1. Urinary. 2. Gastrointestinal. 3. Cardiovascular. 4. Pulmonary. The correct answer is 4. The shake test helps determine the maturity of the fetal pulmonary system. The test is based on the fact that surfactant foams, when mixed with ethanol, the more stable the foam, the more mature the fetal pulmonary system. Although the shake test is inexpensive and provides rapid results, problems have been noted with its reliability. Therefore, the lecithin-sphingomyelin ratio is usually determined in conjunction with a shake test. A 34-year-old female with a history of asthma is admitted to the emergency department. The nurse notes that the client is dyspneic, with a respiratory rate of 35 breaths per minute, nasal flaring, and use of accessory muscles. Auscultation of the lung fields reveals greatly diminished breath sounds. Based on these findings, which action should the nurse take to initiate care of the client? 1. Initiate oxygen therapy as prescribed and reassess the client in 10 minutes. 2. Draw blood for an arterial blood gas. 3. Encourage the client to relax and breathe slowly through the mouth. 4. Administer bronchodilators as prescribed. The correct answer is 4. In an acute asthma attack, diminished or absent breath sounds can be an ominous sign indicating lack of air movement in the lungs and impending respiratory failure. The client requires immediate intervention with inhaled bronchodilators, IV corticosteroids, and possibly IV theophylline. Administering oxygen and reassessing the client 10 minutes later would delay needed medical intervention, as with drawing blood for an arterial blood gas analysis. It would be futile to encourage the client to relax and breathe slowly without providing the necessary pharmacologic intervention. A multigravida client at 34 weeks gestation visits the hospital because she suspects that her water is broken after testing the leaking fluid with nitrazine paper. The nurse confirms that the client's membranes have ruptured when the paper turns which of the following colors? 1. Yellow. 2. Green. 3. Blue. 4. Red. The correct answer is 3. If the client's membranes have ruptured, the nitrazine paper will turn blue, an alkaline reaction, False positives may occur when the nitrazine paper is exposed to blood or semen. The definitive test for rupture of membranes is Fern testing, where amniotic fluid is allowed to dry on a slide and then viewed under a microscope. Dried amniotic fluid will form a Fern pattern. No other fluid forms this type of pattern. A client uses a metered dose inhaler to aid in management of asthma, which action indicates to the nurse that the client needs further instruction regarding its use. Select all that apply. 1. Activation of the MDI is not coordinated with inspiration. 2. The client inspires rapidly when using the MDI. 3. The client holds his breath for 3 seconds after inhaling with the MDI. 4. The client shakes the MDI after use. 5. The client performs puffs in rapid succession. The correct answers are 1, 2, 3, 4, and 5. Utilization of an MDI requires coordination between activation and inspiration. Deep breaths to ensure that medication is distributed into the lungs, holding the breath for 10 seconds or as long as possible to disperse the medication into the lungs, shaking up the medication in the MDI before use, and a sufficient amount of time between puffs to provide an adequate amount of inhalation medication. A prima gravida client at 30 weeks gestation has been admitted to the hospital with premature rupture of the membranes without contractions. Her cervix is 2 centimeters dilated and 50% effaced. The nurse should next assess the clients. 1. Red blood cell count. 2. Degree of discomfort. 3. Urinary output. 4. Temperature. The correct answer is 4. Premature rupture of the membranes is commonly associated with chorioamnionitis or an infection. A priority assessment for the nurse to make is to document the client's temperature every 2 to 4 hours. Temperature elevation may indicate an infection. Lethargy and an elevated white blood cell count also indicate an infection. The red blood cell count would provide information related to anemia, not infection. The client is not in labor. Therefore, assessing the degree of discomfort is not a priority at this time. Urinary output is not a reliable indicator of an infection, such as chorioamnionitis. The nurse is planning to teach a client with chronic obstructive pulmonary disease how to cough effectively. Which of the following instructions should be included? 1. Take a deep abdominal breath, bend forward, and cough 3 or 4 times on exhalation. 2. Lie flat on the back, splint the thorax, take 2 deep breaths, and cough. 3. Take several rapid, shallow breaths, and then cough forcefully. 4. Assume a side-lying position, extend the arm over the head, and alternate deep breathing with coughing. The correct answer is 1. The goal of effective coughing is to conserve energy, facilitate removal of secretions, and minimize airway collapse. The client should assume a sitting position with feet on the floor if possible. The client should bend forward slightly and, using pursed lip breathing, exhale. After resuming an upright position, the client should use abdominal breathing to slowly and deeply inhale. After repeating this process 3 or 4 times, the client should take a deep abdominal breath, bend forward, and cough 3 or 4 times upon exhalation. Lying flat does not enhance lung expansion. Sitting upright promotes full expansion of thorax. Shallow breathing does not facilitate removal of secretions, and forceful coughing promotes collapse of airways. A side-lying position does not allow for adequate chest expansion to promote deep breathing. A multigravida client at 34 weeks gestation with premature rupture of the membranes tests positive for group B streptococcus. The client is having contractions every 4 to 6 minutes. Her vital signs are as follows: blood pressure 120/80, temperature 100 degrees Fahrenheit, pulse 100 beats per minute, respirations 18 breaths per minute. Which of the following would the nurse expect a primary health care provider prescribe? 1. Intravenous penicillin. 2. Intravenous gentamicin sulfate. 3. Intramuscular betamethasone. 4. Intramuscular cefaclor. The correct answer is 1. Because group B streptococcus is a gram-positive bacterium, the primary health care provider probably will prescribe intravenous penicillin to treat the mother's infection and prevent fetal infection. Gentamicin sulfate, which acts on gram-negative bacteria, would be inappropriate. Administering a corticosteroid, such as betamethasone, is inappropriate because the premature rupture of the membranes enhances fetal lung maturity. The lack of amniotic fluid causes early maturation of lung tissue. Cefaclor, which is available only in the oral form, is used for upper and lower respiratory tract infections and urinary tract infections by gram-negative staphylococci. The nurse administers theophylline to a client. When evaluating the effectiveness of this medication, the nurse should assess the client for which of the following: 1. Suppression of the client's respiratory infection. 2. Decrease in bronchial secretions. 3. Less difficulty breathing. 4. Thinning of tenacious, purulent sputum. The correct answer is 3. Theophylline is a bronchodilator that is administered to relax airways and decrease dyspnea. Theophylline is not used to treat infections and does not decrease or thin secretions.
You can get my NCLEX review bundle. Links will be in the description. I'll see you guys in the next video.